NLN Nursing Entrance Exam Review Questions. Question 1. Which 4-flow rate delivers 0.5 L over 5 hours using a 20 GTT/ml set in this health literacy item? Option A, 2000 GTT/min. Option B, 33 GTT/min. Option C, 100 GTT/min. Option D, 2 GTT/min. The correct answer is option. Convert 0.5 L to 500 ml, then use 500 times 20 divided by 5 times 60 to get about 33 GTT/min. The other choices come from common errors such as skipping the drop factor, using hours instead of minutes, or rounding before the final step. Question 2. During a quick NEX review of a safety protocol item, which word is closest in meaning to prevent in a health article? Option A, measure. Option B, decorate. Option C, allow. Option D is stop. The correct answer is option. Prevent means stop, so that choice matches the meaning in context. Measure means find size, not stop. Decorate means adorn, not stop. And allow means permit, not stop. Question 3. After checking the choices in a concept map item, which answer identifies the substance dissolved in a solution? Option A, solvent. Option B, precipitate. Option C, catalyst. Option D, solute. The correct answer is option. The solute is the material being dissolved. Solvent does the dissolving, precipitate is a solid that forms in solution, and catalyst speeds a reaction. Question 4. If a hydration log stem gives one clear clue, which inference is best supported by the passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed sets remove all content gaps. Option C, the exam has no time pressure. Option D, timed practice can build exam familiarity. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Time sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 5. When time is limited on a vital signs question, which critical thinking response best fits this situation? A test item asks for the best answer, and two choices are true but only one directly answers the stem. Option A. The longest answer is automatically best. Option B. Any true statement is always best. Option C. The first familiar term should be chosen. Option D. The choice that directly answers the stem should be selected. The correct answer is option. Entrance exam items often include true distractors that do not answer the specific question. The longest answer is automatically best, does not follow from the situation. Any true statement is always best, does not follow from the situation, and the first familiar term should be chosen, does not follow from the situation. Question 6. Given the information in a cell energy item, which value of x solves 2x plus 12 equals 16? Option A, 3. Option B, 2. Option C, 4. Option D, 1. The correct answer is option. Subtract 12 from both sides to get 2x equals 4, then divide by 2 to find x equals 2. The other choices result from stopping after subtraction, adding 1 too many, or not reversing the operations in the equation. Question 7. Suppose a similar patient teaching item appears on test day. Which word is closest in meaning to reluctant in a health article? Option A, hesitant. Option B, silent. Option C, eager. Option D, formal. The correct answer is option. Reluctant means hesitant, so that choice matches the meaning in context. Silent means quiet, not hesitant. Eager means willing, not hesitant. And formal means official, not hesitant. Question 8. While working through a timed dosage label set, which answer identifies the transfer of heat through direct contact? Option A, radiation. Option B, evaporation. Option C, convection. Option D, conduction. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Radiation transfers energy by waves, evaporation is liquid changing to gas, and convection moves heat through fluid circulation. Question 9. Before choosing an answer in an infection control item, Which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, long paragraphs are best for patient teaching. Option B, clear formatting helps readers understand health information. Option C, headings reduce the value of information. Option D, pictures make written instructions unnecessary. The correct answer is option. The sheet is designed to improve readability and comprehension. Long paragraphs are best for patient teaching, is not supported by the passage. Headings reduce the value of information, is not supported by the passage. And pictures make written instructions unnecessary, is not supported by the passage. Question 10. A student sees this fall prevention idea on a NEX review. Which increase is shown from Monday 12 to Wednesday 20 in a simple practice chart? Option A, 8. Option B, 32. Option C, 20. Option D, 5. The correct answer is option. The increase is the final value minus the starting value, 2012 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. One nutrition note practice problem tests this skill. Which increase is shown from Monday 13 to Wednesday 21 in a simple practice chart? Option A, 21. Option B, 34. Option C, 8. Option D, 5. The correct answer is option. The increase is the final value minus the starting value, 2113 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 12. Several choices look tempting in an oxygen exchange item. Which word is closest in meaning to significant in a health article? Option A, important. Option B, minor. Option C, distant. Option D, damp. The correct answer is option. Significant means important, so that choice matches the meaning in context. Minor means not important, distant means far away, not important, and damp means wet, not important. Question 13. For this study schedule nursing entrance question, which answer identifies the repeating a study to see if results hold? Option A, a classification. Option B, bias. Option C, replication. Option D, estimation. The correct answer is option. Replication checks whether results are reliable across repeated trials. Classification is grouping items, bias is a systematic error, and estimation is an approximate calculation. Question 14. In a short lab safety practice STEM, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A, volunteer programs grow without communication. Option B, former patients stopped the program. Option C, personal stories can motivate people to participate. Option D, orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Volunteer programs grow without communication is not supported by the passage. Former patients stopped the program is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 15. Among the choices in a blood flow item, which answer identifies the group that does not receive the experimental treatment? Option A, a control group. Option B, conclusion. Option C, experimental group. Option D, a sample. The correct answer is option. A control group provides a comparison for the treatment group. Conclusion is the final interpretation, experimental group receives the treatment, and sample is the participants or items studied. Question 16. Using the facts in a kidney function question, which second quantity matches a 2:5 ratio when the first quantity is 6? Option A, 6. Option B, 18. Option C, 15. Option D, 21. The correct answer is option. The first part grew from 2 to 6, so the scale factor is 3. Multiplying the second part, 5 times 3, gives 15. The other values use the total, the first quantity, or an extra scale step instead. Question 17. Based on the clue in an immune response item, which word is closest in meaning to vital in a health article? Option A, ordinary. Option B, distant. Option C, essential. Option D, optional. The correct answer is option. Vital means essential, so that choice matches the meaning in context. Ordinary means common, not essential. Distant means far away, not essential. And optional means not required, not essential. Question 18. Consider this high-yield medication math concept. Which answer identifies the tiny vessel where nutrient and gas exchange occurs? Option A, a trachea. Option B, a vein. Option C, capillary. Option D, artery. The correct answer is option. Capillaries have thin walls that allow exchange with tissues. Trachea carries air, vein returns blood to the heart, and artery moves blood away from the heart. Question 19. Near the end of a reading passage review session, which answer best explains the author's point? A school added quiet study rooms, and students reported fewer distractions. Option A, distractions are always helpful. Option B, students no longer needed to study. Option C, reducing distractions can improve study conditions. Option D, quiet rooms increase noise. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Distractions are always helpful is not supported by the passage, students no longer needed to study is not supported by the passage, and quiet rooms increase noise is not supported by the passage. Question 20. Across similar grammar check nursing entrance questions, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. The graph shows a possible association but does not prove causation by itself. Option B. Graphs cannot show patterns. Option C. A rising graph proves the policy caused everything. Option D. The policy must be ignored. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. Graphs cannot show patterns does not follow from the situation. A rising graph proves the policy caused everything does not follow from the situation, and the policy must be ignored does not follow from the situation. Question 21. Since only one choice fits the word knowledge clue, which weight in pounds is closest to 60 kilograms using 1 kilogram equals 2.2 pounds? Option A, 27.27 pounds. Option B, 1,320 pounds. Option C, 62.2 pounds. Option D, 132 pounds. The correct answer is option. Multiply kilograms by 2.2, so 60 times 2.2 equals 132 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 22. From the information in a data table item, which word is closest in meaning to analyze in a patient education passage? Option A, float. Option B, forget. Option C, decorate. Option D, examine. The correct answer is option. Analyze means examine, so that choice matches the meaning in context. Float means rest on a surface, not examine. Forget means fail to remember, not examine. And decorate means make attractive, not examine. Question 23. At a testing desk during an algebra review, which answer identifies the organ that produces bile? Option A, pancreas. Option B, gallbladder. Option C, liver. Option D, kidney. The correct answer is option. The liver produces bile, which helps digest fats. Pancreas secretes enzymes and hormones, gallbladder stores bile, and kidney filters blood. Question 24. Inside a heart rhythm science or skills item, which answer best explains the author's point? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, the refresher removed all risk permanently. Option C, a training increased infection rates. Option D, a training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection is not supported by the passage. The refresher removed all risk permanently is not supported by the passage, and training increased infection rates is not supported by the passage. Question 25. Through careful reading of a lung function stem, which increase is shown from Monday 19 to Wednesday 29 in a simple practice chart? Option A, 10. Option B, 29. Option C, 7. Option D, 48. The correct answer is option. The increase is the final value minus the starting value, 2919 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.